Well, good morning. Welcome to the Christian Hospital Town Hall, our virtual town hall. This replaces our community leaders breakfast. Typically on this day, we would have our community leaders breakfast and invite the community in and have breakfast with us and share vital information with you. We still wanted to share vital information with you. But we're doing it virtually in this new world that we live in. And so today, our topic is COVID-19. But not only COVID-19, but how has it affected North County? How has Christian Hospital responded? And then how is Christian Hospital keeping you safe as we go forward in this new world? Because we are open for business for all of your healthcare needs. And so I have an all-star lineup of doctors, health legislators with us this morning that can talk to you more about COVID-19 and answer some of your questions. We're even going to answer some of your questions because you've even had a chance this morning or yesterday or the day before to send in questions as well. So I will start off this morning with one of the physicians that work here at Christian Hospital, Dr. Onifade. Dr. Onifade is a primary care physician and a hospitalist at Christian Hospital. He regularly consults with clients on physician practice management and advises physicians on hospital utilization management. So Dr. Onifade, let's just start off with something simple. What is COVID-19?
Good morning, everyone, and welcome. It's my pleasure to be here. COVID-19, and I'm going to be very simple, is a new virus that the human race, the global community, has never encountered before. And so no one has an immune response to it. It is a virus that causes a range of illness, primarily affecting the lungs, but it can affect other systems of the body. The illness can range from being mild, because we hear in the news all the time that many people can have no symptoms, to being very severe, where patients are gravely ill and some even die. And so the challenge of COVID-19 is that it spreads very quickly. The rate of spread increases when there are large group gatherings, dense setting. It does not discriminate in terms of age, race, or gender. It is just takes the opportunity if you are in a situation where you can be in close contact with it.
So Dr. Onifade, we hear a lot about wearing a mask. I have a mask here with me that I wear. A lot of people feel they shouldn't wear a mask. But even now, why should we wear a mask? Because some people think, well, it's the summer. We're not seeing as many cases as we did before. But why should we still wear a mask even today with the virus that's still out there?
Thank you. So, as I said, the biggest challenge about the COVID-19 virus is that it's new. We are learning about it as we are being impacted by it. And to that extent, masking is critical in that, as I said, the infection sets in by contact. When you wear a mask, you decrease the risk of infection from you infecting others, or possibly you getting exposed to the COVID-19 that others might be infected with. Now, the challenge, as I said, is that about 80% of people have very mild symptoms, or they might not have symptoms at all. And so it's not always possible to know if someone has this infection. And the fact that someone may not have any symptoms does not mean that if you were to catch it, you may not be one of the people that becomes critically ill. So wearing a mask is really a duty and responsibility to protect others from the possibility that you may already have COVID-19 and just not know that you have it, and just the safety of the communities and the people that you love and work with around you.
Thank you so much for that information, Dr. Onifade. Our next guest is Dr. Carol Nwelue. Dr. Nwelue is the medical director of the BJC Medical Group Hospitalist Service here at Christian Hospital, where she has been a strong advocate for the specialty of hospital medicine for the system. Dr. Nwelue received a medical degree from the University of Texas Medical Branch. Dr. Nwelue, we hear about the virus. So what does the virus do to some patients once they actually have the virus?
A really good question. Brad, if you could show my slide. And I found a great picture actually in the San Francisco Chronicle that looks at the different areas of the body that the virus can affect. And as Dr. Onifade talked about, it's really everywhere. It does a lot of different things. So it can affect the brain, the heart, the lungs. We see a lot of damage to the blood vessels in all of these organs, the kidneys and the intestine.
So when people come into the hospital with some symptoms, what symptoms are you seeing the patients have when they first come in? And then what are some of the symptoms as it maybe progresses in some people, but not all?
For the people that are coming to the hospital, there's a small percentage of people that we have found, as Dr. Onifade spoke about too, that are asymptomatic. So they may be coming in for something totally different, maybe coming for a surgery, as our surgeries are now back up and running. And we're testing people for COVID before some of these procedures, and they may come back positive. But most people are coming in with fever, shortness of breath. We are seeing some abdominal pain, some people with diarrhea, no fever. A lot of people that just feel fatigued, feel like they've run a marathon and haven't done anything different. We're seeing people come in with strokes, with seizures, with heart attacks, confused, almost like they have dementia, and kidney disease.
And so once your team takes great care of the patients once they get here, we've noticed that a lot of the patients go to rehab. Why is rehab necessary for some of the patients that have the virus?
So the virus is very good at what it does, we'll say, and can definitely bring down even some of the strongest, healthiest patients. We've seen patients in their 20s and 30s that once they've overcome the virus, maybe they're breathing better, they're not requiring to be in the hospital anymore, but still they're so weak that they have to go to rehab to get their strength back. And so they really focus on physical therapy, occupational therapy, speech therapy for some of our patients to get them back on the road to recovery, even after being in the hospital.
We've heard about the drug Remdesivir and the potential that Remdesivir can have on treating the virus. Can you tell us a little bit more about Remdesivir and how we're using that here at Christian Hospital?
Yeah, so Remdesivir is a drug that was actually created 2015, 2016, and the hope was that it would help treat patients with Ebola at the time. And what we found through research is that it looks like this drug can help prevent the disease from spreading in the body. It decreases the replication, so the disease can't just keep revving itself up once it gets in your system. We've seen patients not need to be put on the breathing machine once they've received this medication. We've seen patients start to recover, and it can slow down the duration so that people who would normally take 10 days may be taking 5 to 7 days before leaving the hospital. So it's decreasing the amount of time that people are sick, and we're very happy about having this drug here at Christian.
Yes, we are. Christian Hospital was one of only 18 hospitals in the state of Missouri to receive Remdesivir. So we're very glad we can administer that to the patients that need it at this time. Thank you, Dr. Nwelue. Our next guest is Dr. Ross. Dr. Ross is Associate Dean for Diversity at Washington University School of Medicine and Professor of Medicine in the Division of Nephrology. As a public health and health policy expert, Dr. Ross focuses on systems integration and conceptual frameworks to reduce healthcare disparities. So that leads me into the next question. I've gotten a lot of questions from the community about the virus, but specifically individuals have heard about how the virus has affected North County and African Americans. So my question to you, Dr. Ross, is how does health disparities, social determinants of health, systematic racism affect African Americans, Hispanics, and other vulnerable populations as it relates to the virus?
Thank you. First, thank you for the forum to speak about this with these really remarkable people on this panel. We know that all pandemics are local. What I mean by that is that pandemics are global, they're worldwide, but when they hit a particular community, they're not simply hitting the community equally. Every individual has susceptibility, but there are certain individuals who are more susceptible to this virus. These are the individuals who, because of long-standing inequities, inability to reach their full health potential due to social and structural determinants of health, people who don't have adequate health care, who don't have adequate access to proper medications, who don't have adequate access to good nutrition. These are the individuals who are going to be more likely to be hit hardest by any particular infirmity. It could be COVID-19. It could be an increased likelihood of dying from breast cancer in women. It could be an increased likelihood of a child not being able to live to their first birthday because of the high infant mortality. And it could be from the continued prevalence of diabetes and high blood pressure and kidney disease. These diseases are more likely to affect vulnerable communities because, again, these communities don't have the really good safety net to protect them in terms of having really good access to care, access to providers who are based in the community, access to affordable health care as well as insurance. And so I always state that when America sneezes, African Americans get the flu. And so when we first heard of this pandemic back in January, my first thought and the thought of all of us who are epidemiologists was, oh my goodness, it's coming for the Black community. We should be really involved and we should really protect this community because that's the most vulnerable community. It's not just African Americans, it could be all vulnerable communities. The Latino community in America, the community that's most affected are the Native American communities. So that's why these disparities are more common in response to this pandemic.
And so I guess maybe to that, and maybe this is the same question, but why has North County been more affected than maybe other areas in the region?
Well, thanks. Let me just show a couple of slides to really highlight that. And so if I can have the slides, please. So can you skip to the next slide? Before I answer that, next slide, please. Before I answer that question, I do want to provide your audience some good news that when we look at the 7-day moving average, it's actually a 2-week moving average, we are seeing a reduction in the cases in COVID-19. So what we have been doing in the past has worked. You know, the social distancing, wearing the mask, the shelter-in-place orders. We've abided by that, and that seems to be working. Next slide. And we also have seen a reduction in hospitalizations as a consequence. So next slide. So this is a question that we're being posed. So why are certain zip codes more likely to be affected by COVID-19? And I'm going to take this slide and the subsequent one and have you look at certain zip codes. And those zip codes in North St. Louis are the same zip codes that you'll see if I were presenting discussion on homicides, gun violence, if I were discussing asthma mortality rates, if I were discussing maternal mortality, you name it. It would zone in. It would really overlay around 2 or 3 zip codes in North St. Louis. You can see those shaded in the darker purple. And in the next slide, please, you'll see the same effect in the city of St. Louis. Certain zip codes are high risk. Again, these are coded in the darker purple, the ones with the highest rates of COVID-19. And you can see those zip codes. We've watched those zip codes for decades, and those are the ones that have the greatest concentration of poverty, joblessness, low educational attainment, which is going to really, again, put those individuals at highest risk for having COVID-19.
Thank you for that explanation, Dr. Ross. Our next guest this morning is Dr. Olaronke Akintola. Dr. Akintola is a pathologist and associate chief of the medical staff here at Christian Hospital. So Dr. Akintola, there's been another treatment for COVID-19 out there, and we know it is convalescent plasma therapy. So can you tell us a little bit about what convalescent plasma therapy is and how it helps an individual who has the virus?
Thank you, Mr. Stevens. Good morning, everyone. Convalescent plasma therapy is not a new therapy. It was used during the flu of 1918, as well as the more recent viral outbreaks of SARS and MERS. What convalescent plasma is plasma from patients who have recovered from the underlying disease, in this case, COVID, is collected and is transfused to patients who have the disease. And the studies have shown, based on previous diseases, that this does shorten the length of the disease and is at this point, when there are no other medications, helpful. So for instance, in the 2012 MERS outbreak, it decreased patients that were treated within the first 14 days had an earlier discharge from the hospital. We're very happy that we are able to provide this to our patients at Christian, working under the Mayo Review Board and the FDA. And we have seen some promising results with our patients both here and within the system as a whole.
Thank you for that. Can you also tell us about antibody testing versus molecular testing?
So the molecular testing, PCR, is the gold standard for testing. That will tell you if you have the disease. Antibody testing just says you've had it. It is not used for diagnosis. So I know that a lot of people are excited about the availability of antibody testing. At this point, since COVID is a novel virus, we're really not sure that if you have a positive antibody test, what that means. It will tell you that you've had the disease, but whether it provides any ongoing immunity or not remains to be seen.
Okay, thank you for that. Well,
You're
I just
welcome.
wanted the audience to know with the Remdesivir and convalescent plasma therapy, we are working very hard to make sure that we have the latest treatments to keep the community well if they were to get the virus here at Christian Hospital as well. The other thing I wanted to share with you all this morning is how Christian Hospital is still open for business, open for all the other things that we do on a daily basis, and how we're keeping you safe. So this next person is Dr. Duane Moore. Dr. Moore is the Chief of Emergency Medicine at Christian Hospital, Northeast and Northwest Healthcare for the past 2 years. He is a director of the board of the Northeast Ambulance and Fire Protection District as well. So Dr. Moore, being over the emergency rooms at Christian Hospital, we're hearing about individuals that are delaying their care because of COVID-19. But tell us why it's important to come to the ED if you're experiencing an emergency. And then also tell us how safe it is to come to Christian Hospital or to any hospital really, but particularly here, Christian Hospital.
Good morning. Thank you for having me on and giving me the opportunity to address these issues. And so first and foremost, you asked about why is it important that people not delay care in the emergency department. It's important not to delay care in the emergency department because a large number of things that we encounter are time sensitive. And what that means is our ability to give patients a good outcome is largely dependent on our ability to promptly make a diagnosis and initiate treatment. If a person is having a stroke, it is imperative that they be treated in a timely manner to give that person an opportunity to be able to use their limbs and use their speech. If a person is having a heart attack, it's very important that that be treated in a very timely fashion. Also, we have a heavy burden of kidney disease in North County. And so it's very important that people with kidney disease and hypertension are being treated quickly to prevent worse outcomes. You also asked about how safe is it in the emergency department and what things are we doing in the emergency department and Christian in general to make sure that staff, visitors, and patients are safe. So upon entry into the building, we are screening patients, staff, and visitors with screening questions that ask about symptoms that could be indicative of them having an infection. Also, we are testing people's temperature to determine if they have a fever, and also handing out masks as people enter the building if they don't have one. And so by doing these things, we're keeping staff, patients, and families safe. Also, what we're doing is making sure that the providers are not a danger to patients by making sure that we have the proper PPE or protective wear.
Okay, thank you, Dr. Moore, for that. Dr. Weltmer is our next guest, and Dr. John Weltmer is the Chief of Surgery at Christian Hospital and orthopedic surgeon. He has more than 20 years of clinical experience and specializes in adult reconstructive foot and ankle surgery. So, Dr. Weltmer, we stopped doing elective surgeries in March, so I'll start off easy here. So, can you tell the audience what is an elective surgery?
Thank you. I also apologize. For some reason, my video wasn't working on my phone or the computer I borrowed, so you're just going to have to hear my voice.
Okay. We can hear you.
Elective surgery is anything that can wait, such as if someone has an artificial joint, total knee, that's something can wait. Where emergency surgery, somebody has a trauma, somebody has a heart attack, something of that sort. And so the elective surgery was stopped just to take the strain off the hospital, since obviously everybody had lots of issues, and unfortunately Christian had a very large proportion of that.
Absolutely. So as Dr. Moore said, it is safe to come back to the hospital, but how safe is it for patients to come to the hospital for a surgery now?
Actually, it's probably one of the safest places you can be in North County. All the patients that are coming in for the elective surgery are all being COVID tested. So we want to make sure to protect both the patients and also all of our staff, so the patients know that they do not have the virus. You're also coming into surgery in a controlled environment. Everybody who works in surgery is used to all the PPE that everybody's heard about, the personal protective equipment. We do it every single day. We've been doing it for as long as we've been working there. We're used to sterility. We're used to keeping ourselves safe as well as the patients safe. We've also changed a lot of the processes that we normally do to make it safer for both family as well as patients. It's also one of the rare patient areas where family can actually come in with the patient, be there before surgery. If it's an outpatient procedure, then be with the patient when they wake up. Everybody else probably knows you can't come in the hospital because of the COVID issue. For surgery, you can be with your family member both before and after surgery to relieve the anxiety and stress for everybody as well. But again, you're protected in that environment. You stay in the room where you are, or you leave and we contact you to have you come back. So both you're safe as well as the other people involved are safe.
Thank you. And so as Dr. Moore and Dr. Weltmer said, it's very safe to come into Christian Hospital. Don't delay your care. Go see your doctor. Because what we did see is, you've probably heard nationally, we have seen people who have delayed their care. And as Dr. Moore said, we've seen some people coming in with strokes and heart attacks as well. So we were not immune to what the national reporting was as well. So come to the hospital. It's safe. People are wearing masks. Everybody is masked in the hospital. Your temperature is being checked. And as Dr. Weltmer said, it's probably the safest place to be from all the sterility and the sterile practices that we practice here at Christian Hospital. Now I'd like to move on to a legislative piece about COVID-19. I have with me this morning Representative Tommie Pierson. He represents part of St. Louis County and St. Louis City, District 66, in the Missouri House of Representatives. He was first elected to his first two-year term in November of 2016. In addition to his legislative duties, Representative Pierson is a math teacher in North St. Louis County and the pastor of Instep Church. So, Representative Pierson, you've heard us talk about COVID-19 this morning. So what are some things that we're doing at the state level to address COVID-19 and have an impact here in North County as well?
Excellent. Well, thank you for just this opportunity to be on this panel and discuss this very important issue. From the state level as it relates to the COVID-19 pandemic, I wanted to just frame it in two areas for the sake of today's presentation. And those two areas are elections and funding. And so by way of elections, we passed Senate Bill 631 that actually the governor signed yesterday. And what that does is it provides two methods by which Missourians can avoid voting in person in crowded polling places during this year and this year only, this year's elections. And so one is expanding absentee voting to include folks at higher risk of contracting COVID-19. If people are deemed at risk of contracting or suffering from COVID-19, then they can vote absentee. And being at risk is defined as having one of the following conditions: being 65 years of age or older, live in a licensed lung care facility, have chronic lung disease or moderate to severe asthma, have serious heart conditions, diabetes or liver disease, be immunocompromised, have chronic kidney disease and undergoing dialysis. And then the other method is mail-in voting. And this option is available to everyone. And so the difference between the two is that an absentee ballot does not require notarization, but a mail-in ballot does, which makes the latter option a bit less convenient. And again, that's only for this year. The other category real quickly is in funding. The Treasurer's Office has done a pretty decent job in breaking down where the federal funds for the CARES Act are going nationwide. And so I would refer folks to treasurer.mo.gov/COVID. Again, that's treasurer.mo.gov/COVID. And so roughly $520 million is going to local governments. $215 billion is going to medical assistance services, and $27 million is going to the Department of Elementary and Secondary Education. And so just by way of a brief update of some of the things that are going on at the state level, and I just certainly encourage us to continue to be vigilant to prevent any kind of second wave and to continue to flatten that curve.
Thank you for that information, Representative Pierson. Next, I have with us Representative Lacy Clay. Mr. Clay, who is currently serving his 10th term, was first elected to the U.S. House in 2000 after serving 17 years in both chambers of the Missouri State Legislature. The Congressman is the chairman of the House Financial Services Subcommittee in Housing, Community Development, and Insurance. We also want to thank Representative Clay for being an advocate here in the state of Missouri to expand Medicaid. We'll talk a little bit more about that later, and it goes back to what Dr. Ross was saying about access, but the vote for Medicaid expansion in the state of Missouri is August 4th. So Representative Clay?
Yeah, good morning, Rick, and good morning to the Christian Hospital family, and thank you for having me on.
Absolutely. So just a question to you is, what other federal legislation is being proposed to help those who've been affected by COVID-19 and the effect it could have on North County?
Well, based on the fact that we now have over 40 million Americans unemployed, it's absolutely vital that the Senate schedule a vote on the HEROES Act and pass it ASAP. And if Leader McConnell refuses to do that, then he better come up with his own compromise package immediately, because states, counties, and cities are on the verge of deep cuts in vital services, and that includes health care. You know, the House passed the HEROES Act last month, and the HEROES Act is based on our 3 pillars: opening the economy with a science-based path of testing, tracing, treatment, and social distancing. Our legislation commits another $75 billion for the testing, tracing, and treatment we need, and helps ensure that every American can access free coronavirus treatment. It also provides strong support for our heroes, with nearly $1 trillion for state, local governments on the front lines who desperately need funds to pay the healthcare workers, police, fire, transportation, EMS, teachers, and other vital workers who keep us safe and are in danger of losing their jobs. And you know, the HEROES Act also includes a new $200 billion HEROES Fund to ensure that essential workers receive hazard pay, including dedicated healthcare workers, like the ones on this at this meeting. It would also put money in the pockets of workers with a second round of direct payments to families up to $6,000 per household. New payroll protection measures to keep 60 million workers connected with their jobs, and extending weekly $600 federal unemployment payments through next January.
That's great to hear. We look forward to that coming out, and thank you again for all the work that you're doing for us here in North County as well.
Thank you for having me today.
You're welcome. Those are all our panelists this morning, and so we have close to 120 people that have signed up for this virtual town hall this morning. And you had the opportunity to send questions in, and so now I want to get to those questions in the last 25 minutes that we have, and I'll ask some of our panelists to assist me in answering some of these questions where I don't have the answer, or add to the answer as well. The first question is, has Christian Hospital been able to manage the pandemic influx the last few months without being overwhelmed? I can immediately think of Dr. Moore and Dr. Nwelue. I would just have to say we were able to manage the influx. As we know that we've been very busy, as we've always been, but we've been able to adapt to the change. And that's what we have great staff here that can do that. And we've discharged over 200 individuals from the hospital that have had COVID-19 as well. But Dr. Moore or Dr. Nwelue or any other doctors, Dr. Onifade, Dr. Weltmer, would you like to add anything more to that question as well? Have we been able to manage the pandemic?
This is Dr. Moore, absolutely. I can definitely speak to that. Northeast and Northwest combined have one of, if not the busiest emergency department in the state of Missouri. And so what we do and what we're good at just on a normal basis is taking care of a lot of really sick people. There's a very high burden of hypertension, kidney disease, respiratory ailments already in the service areas. And so that kind of played itself out with the pandemic. The ironic part with the pandemic is that the actual volume of patients coming through the emergency department was about 40% lower than what we anticipated. Notwithstanding that, the patients that actually did come through the door were sicker than what we typically anticipated. And so with the total volumes being down, even with the very high acuity, we have certainly been able to manage that and have been adjusting our staffing from a provider and on the nursing side to accommodate.
Thank you. Another question is, what precautions should the public take while attending community events? And then I guess the second part to that is how can individuals protect themselves in their office space from COVID-19? What precautions should the public take while attending community events? I think we still have to, Dr. Ross and Dr. Nwelue, Dr. Weltmer, Dr. Moore, but we still have to follow that guidance of the social distancing, the physical distancing, and the mask. Anything else maybe to add to that, to enhance that?
Well, I think this is Dr. Ross. I think those are certainly the main protective activities that would need to be adhered to. Of course, we've all been glued to the news watching the protests across the country. And we've been concerned that in the height of this, with all the appropriate outrage directed toward police brutality and the death of George Floyd, that there may be a greater likelihood that individuals will forget to use personal protective equipment in large crowds. But as I was surveying some of the crowds on TV, I was relatively pleasantly surprised at the number of adherents, number of protesters who were wearing masks. I mean, that's the most important thing that we can do. The masks are not just protecting us, but it's protecting others around us, particularly if we could be asymptomatic spreaders. And so having those masks, where possible, having this, the distancing 6 feet. That's not always practical, where possible. And then I hope that everyone can get pockets of hand sanitizers to use as much as possible. Those are the practical things that we can do to mitigate the spread of this.
And with everything that's going on, do you still think, you talked about the protesters, we heard about Lake of the Ozarks, do you still think that there will be a second wave of the virus this summer?
Well, so we've been closely monitoring that case in the Ozarks, and thus far there have been no reported COVID cases. But the problem with that is that those are, we're looking at cases that were reported directly to the health department. Many individuals may have gotten tested at private facilities, and we may not have that data. And so I think the jury is still out. I'm still concerned that we don't have the expansive testing that we should have done, the widespread surveillance so that we can know who's at risk. We've only tested maybe 2-3% of our population, if that. And so we just don't know who doesn't have the disease. And as a consequence, even though the numbers of cases in the hospitals, including Christian hospitals, are falling, that's all good news, as I showed in my chart. We just have to be really vigilant because anything could lead to an uptick. So far, the numbers are promising in terms of not having a large second wave.
Okay, thank you. Here's another question. Maybe it's directed to Dr. Moore, but anyone can answer. If a parishioner arrives for a church service, specifically they said in the Spanish Lake area, but it could be anywhere, with an elevated temperature, can they be directly referred to the Christian Hospital Northeast ER?
Absolutely. As an emergency department, we take all comers for any complaints and do appropriate medical screening and disposition and treat them as appropriately. In addition to that, BJC has several avenues for patients to get testing outside of the emergency department. But your question was, if somebody is at church in Spanish Lake and they have a fever and present to the emergency department, will they be treated? Absolutely. That is what we do. That's our bread and butter.
So anyone that is feeling sick and you feel that you have an emergency, come to the emergency room.
Absolutely.
And so, absolutely. Thank you. Our visitors, go ahead. Yes.
I'd like to add to Dr. Moore's information.
Yes.
I think one of the very important things is to plan ahead. And so we should all be thinking about our symptoms on a daily basis. Am I feeling like I have a fever? Do I have a cough? Do I have shortness of breath? Is there anything different from my baseline? And so from that perspective, if you were planning to go to church or go to a small group gathering and you have any symptom, what I am encouraging and advising my patients to do is to not go and kind of seek understanding to make sure that you are not, in fact, having COVID, because the last thing any of us want to do is to make or contribute to the sickness of the people in our community or in our families, in our churches, etc.
Thank you. Thank you. Another question. This is kind of a loaded question. Maybe Dr. Nwelue will help me, but others will as well. But what is being done or what is in place for a person who tests positive for COVID-19, does not seem to be sick and lives alone, or does not have a safe place to go in their home or elsewhere to quarantine themselves for 14 days?
So that's a good question. And that's something that we've run into from time to time in caring for our patients with COVID-19 infections, probably more so over the last month or so. As has been stated, our numbers have been going down. One avenue that we had was the National Guard, along with the state, had set up an area at the Quality Inn on Dunn and Florissant called the Alternative Care Site. And so for those patients who were unable to quarantine safely in their homes, we would discharge them there. So their National Guard physicians, pharmacists, and nurses would give the patient meals, make sure the patients had their medications, and they would continue out their quarantine time there. Unfortunately, that facility was closed last week due to actually underutilization. It sounds like they had less than 30 patients of the 110 beds available. And so as other things are changing in the state too, you may have heard some about nursing homes and looking to test every nursing home patient and every staff member, and the civil unrest that we've talked some about this morning. So some of those National Guard folks have been deployed in other areas, along with the underutilization of that. We do have that for our homeless population, though. There is the Hawthorne House that has the ability to quarantine patients who have COVID-19 and are unfortunately homeless.
Okay. Here's a couple of questions on testing. So individual says, I'm hearing more and more test sites are opening up. How do we determine if this site is qualified administering the test? And how do you protect the person's personal information? I'll start it. Christian Hospital has a testing site. We've had our testing site since March 21st, and we've tested right now over 1,600 individuals from the community. 314-653-5000 if you're feeling like you have symptoms or you need to be tested for the coronavirus. There are other testing sites by the FQHCs as well. Dr. Nwelue, I believe there was a website as well that maybe could give individuals information of where to be tested, if I'm not mistaken.
Yes, and that was health.mo.gov/living, and it takes you through the health conditions and diseases. From there, communicable diseases, you'll see the area that talks about COVID-19 testing, and it gives you a list of all of the facilities in the state. The majority of facilities are looking to test people who have symptoms. I know Care STL Health in the community is looking to test people who don't necessarily have symptoms as well. So there are places around the state and in this area to be tested.
Another loaded question. Oh, go ahead, Dr. Ross.
I would just add parenthetically about the federal qualified health centers. Individuals who get tested there get tested without having to pay, so there is no direct cost. And I think that should be made abundantly clear. I mean, there are other sites that are created, private sites, where there is an out-of-pocket cost, but FQHCs are generous. They have funding to provide testing at no cost to the individuals.
Okay, thank you for that. Here's another loaded question. When will everyone who wants a test have the opportunity to get a test if they're not showing symptoms?
That is a loaded question. Because in order to get out of this, we need to have widespread surveillance testing. But despite what you may hear, we still have disruptions of the supply chain, and we don't have adequate testing to do what is required. What is required in order to really get this expanded testing is to conduct 1 million, at least anywhere from 500,000 to 1 million tests per day. We're doing about a third of that, and we're certainly seeing a ramping up of testing sites, but we don't have the capacity to test all individuals who want to get tested.
Thank you for that, Beck. I think that was important for people to hear about the supply chain, and we don't have the supplies yet. And so still more to come, and hopefully we can get to that sometime soon. Another loaded question is, when should we expect a vaccine for the coronavirus? And we keep hearing different dates. And so it's a loaded question, but would anyone like to take a stab at that one?
I can say initially, just for historical reference, it usually takes about 10 years for a vaccine to go from discovered to vaccination of the people. And so that is our normal case scenario. Now, the good news is that some people have been working on the coronavirus around the world for some time. Again, what we're talking about, COVID-19, is a novel coronavirus. That's why they call it that. It's new. But there are several other types of coronaviruses that have been around for ages. And so there have been people looking at this type of virus for a long time. And that's why you're hearing, that's why you're not hearing 10 years, is that the hope is that some of the work that has already been done in this area is going to be used to create a vaccine much, much, much faster than we would normally see.
Would someone else like to weigh in? I think I heard a couple people.
Oh, I was going to quote Dr. Anthony Fauci, who in a press conference early this week sounded more positive than he had been before, and that we may be looking. I agree with the comments made by earlier by the prior speaker. I agree 100% with her. But Dr. Fauci felt that based on what we're doing, we could theoretically see a vaccine emerge within 9 months. That's really a short time frame. And there are two or three corporations, institutions that are working on this. I'm watching a group in Oxford, in England, and two groups here in the United States, and they are really going gangbusters. And so I hope Dr. Fauci is right. He said 9 months to a year. That's a really aggressive timetable. I hope he's right.
Okay. Would anybody else like to comment on that? Okay. The next question is contact tracing, and individuals wanting to know about contact tracing and how is it being conducted here, and what is contact tracing? I don't know, Dr. Ross, Dr. Nwelue, Dr. Onifade, Dr. Akintola, Dr. Moore, would anyone like to talk about contact tracing and what it is?
I can start. So the idea of contact tracing is you have a patient who we know has COVID-19. We know this virus has been spreading very quickly. At some point in some areas of the world, it has been one person that could affect 5 other people. The goal of social distancing, masking, washing your hands, and all of these things that we're asking of people is to decrease that spread. So I know I heard we've gotten down to maybe 2 people. And the fewer people that can be affected by one, the better everyone is. So contact tracing is really identifying of this one person who we know has COVID, who all have they been around, who may have been exposed, who may also have it. And that goes back to the importance of being able to test and know who has it and who doesn't, as we look at expanding practices and the economy getting back to where it's been.
Oh, absolutely. And so according to the Centers for Disease Control's guidelines, in a setting of a pandemic, we will customarily want to have about 30 contact tracers per 100,000 population. That number is kind of flexible because we have automated methods of contact tracing, which could make that more efficient. But nonetheless, let's say for the St. Louis region, you get a sense of how many we theoretically would need. The CARES Act funding certainly can have an opportunity to support that level of contact tracing. There are disparate funding streams in the city and the county, and there lies a problem. But nonetheless, there seems to be an appropriate response over the past week in the city of St. Louis on hiring at least 25 more contact tracers. Again, we're ramping that up. I agree with the previous comments. The most important thing about contact tracing is that it has to be focused and it has to be targeted. We have to look at the hotspot areas, given the fact that we don't have the full supply of contact tracers. They have to be deployed in a much more targeted manner to be as effective as possible.
The next question is on visitation to the hospital. Are visitors still restricted from visiting or accompanying a loved one to the hospital? So with that, we do restrict visitors from coming into the hospital. But if an individual is having a surgery, we do allow one person to come with them for that surgery. So if they're having an outpatient surgery, you can come into the waiting room, wait, and then outpatient, that person is leaving the same day. But if that person is having an inpatient surgery where they're going to have to spend the night, we do allow an individual to come, but you're not allowed to go upstairs to the tower, to the inpatient floors as well. And then as a follow-up to that question is, how soon can personal visits resume? Well, we hope as soon as possible, but for right now, we don't have personal visits that are occurring here in the hospital as well. And so with the last 7 minutes, we have one more question. Well, there's one more question. How many cases has Christian had? Well, we've had quite a few cases. We've been in the hotspot here in North County. And so we've taken care of many people. 63136, where the Christian zip code is, has been a hotspot for North County. And then 63033 and 63031 for the county have had the most cases of COVID-19. And so we've been on the forefront. You've heard from Doctors Moore, Nwelue, Weltmer, Dr. Onifade, of just how we've cared for the community. And we've had over 200 discharges here at Christian Hospital of individuals that have had COVID. We've had, just on the numbers side of things, we discharged an individual who was 101 years old who had COVID. And then we've also discharged an individual who was 29. So you can see the spectrum, the age range that we've had of individuals who have had COVID. Our last question, which will be our last question here in the last 6 minutes, and it'll probably be a little bit of a longer response. But the question is, what resources will Christians' community programs, website, and in-hospital educational materials now include to make sure that people are more aware of health disparities, considering how COVID-19 has disproportionately affected the Black community? Well, as I mentioned before, we've stood up a testing center, which we will continue to stand up here at Christian Hospital on March 21st. And we've tested, as I said before, over 1,600 individuals from the community to date. So we will continue with that. We will continue with Community Leaders Forum, or used to be our Community Leaders Breakfast, where we are today, to continue to educate and inform the community about COVID-19 and other things that are occurring in the community. And that's what our Community Leaders Breakfast, or our forum, has always done, to continue to put information out about healthcare and the services that we offer here at Christian Hospital. We also will continue to use our community health workers. If you're familiar with what a community health worker is, it's an individual who has a relationship with people in the community. And so we have community health workers that are at the station at the Empowerment Center in Ferguson, who have developed relationships with individuals in the community so they can also share information with the community and share information about a lot of the things that we talked about this morning, the masking, the social, physical distancing, using the hand sanitizer, knowing what the needs are of the community as well. Those are some things we do now, and we're looking to expand that program, and we're going to continue to do that even more, and going into the communities, as Dr. Ross talked about, that where we know there are health disparities. We will continue to use our clergy board as a sounding board, as an education, as an information vehicle for us as well. We've had as many from 25 to 45 different churches attend our clergy board meeting here at Christian Hospital, and it does wonders of just sharing information and bringing the community together and sharing what information is out there concerning COVID or any other kind of healthcare disease as well, or the services here at Christian as well. We also have a patient family advisory council here at Christian Hospital, where we have actual patients that come in and tell us about our services here at Christian Hospital. And so we will continue with our patient advisory committee, or our PFAC committee, to share information with actual patients so they can share information with others. And then we will also continue our partnership with community organizations like the Salvation Army, like NCI, North County Inc., the Urban League, the Boys and Girls Club. I had a question, and this kind of rolled into this question: how are we going to work with community organizations, maybe like Matthews Dickey's Boys and Girls Club? And we're going to continue that relationship of other not-for-profits, because no one organization can do any of this by themselves. But we can also go further as a community. As I mentioned, we held a community forum or community leaders breakfast at that time earlier this year on the upcoming census and filling out the census. Filling out the census helps bring needed dollars, our fair share, to this community, and a community that needs the monies for housing, education, road repair, and healthcare. Monies for healthcare can lead to more testing and treatment for COVID-19. So let's remember to fill out the census. And so please ask 10 people or more in your circle of influence, have they filled out their census form? And then have those 10 people or more ask 10 or more people, and so on, have they filled out their census form? 10 years ago, Missouri lost a congressional seat because we were woefully undercounted. We don't want to lose a congressional seat. We've had two great political leaders on the line with us today, and they're continuing the fight for us. And we want them to continue that fight for us, but we also want to bring the dollars in. So as Dr. Ross talked about healthcare disparities, we can continue to address those healthcare disparities and bring and have that equalization there so people can have access. The next thing you can do is vote. Representative Pierson talked about voting. The first vote we can do is for Medicaid expansion in the state of Missouri. That vote will take place on August 4th, and you can see that on the screen there. To vote August 4th, one must be registered by July 8th. Expanding Medicaid to individuals in the state will give access to over 200,000 individuals who do not have insurance now. Dr. Ross talked about access. We need to have individuals have access to health care. A person making $3,600 or less, a person making $3,600, you qualify, or less, you do qualify for Medicaid. But if you make $3,601, you do not qualify for Medicaid in the state of Missouri. If you make $5,000, $10,000, and if your employer does not provide insurance for you, you do not qualify for Medicaid. So what does that say? You're probably not going to go to the doctor because you don't have access to health care. This continually perpetuates the inadequacies and inequities that we have in healthcare. We want individuals to have access to healthcare going forward. So go to healthcareformissouri.org for further information. Remember, the vote to expand Medicaid in the state of Missouri is August 4th. There have been some articles on this as well. And remember, to vote on August 4th, you have to be registered by July 8th. So please tell your circle of influence, 10 people or more, and tell those 10 people to tell 10 people as well. And then we can vote again at the local, state, and national level in November for change. Voting for individuals with your interests helps make change, which is progress. Progress is slow, but it matters. And progress helps make changes. Vote for those who can help us make changes in healthcare policies and that can help all and create an equal society. Vote for those who are not afraid to take on the difficult issues. Vote for those that will have discussions on systemic racism. And then after we have the discussion, we hope that they will implement policies that can help us move forward and not take us back to 1820 or 1920. Vote for those who have critical thinking skills to solve problems and not a philosophy to solve problems. Vote for those who want a more fair and equitable society. Equitable, equal. As Laura Coates says, equality is not like pie. You do not get less because I get some. Black Lives Matters does not mean no one else's lives matter. Black Lives Matters focuses on a certain problem, that there is an actual systemic issue related to different groups of people in this world. Let's have the conversation and have active listening about policing, the inequities in healthcare, and then let's implement like vote for Medicaid expansion. Implement the recommendations in the For Sake of All that Jason Purnell put out. Implement the recommendations from the task force on the 21st century policing. When a police officer can kneel on someone's neck for 9 minutes on camera and think there will not be any consequences, that shows to me a country divided. Therefore, inequities continue. The World War II Germans used the slogan, divide and conquer. But at that time, the US said, we are stronger together as a society and not divided. Many of you know how World War II turned out. We were victorious. We were victorious because we were together as a society. America is a great country. We can continue to be victorious, but we have to be together and not divided. So let's all work together with our differences to make us stronger together. We are at our time. We are a little bit over. I want to thank the 120 plus who joined us this morning for our community leaders breakfast or our community leaders forum. We didn't serve you breakfast, but maybe you're having breakfast or coffee or tea where you are right now. We look forward to seeing you again later this summer as we talk about a lot of the issues that are happening in our community, how to keep you healthy, and to talk to you about the services that are here at Christian Hospital as well. So thank you again for joining us this morning, and we look forward to seeing you real soon at the hospital or in the community as well. So thank you and have a great day.
Thank you.